type 1 diabetes mellitus. Let's talk about the pathophysiology. Diabetes is a chronic endocrine disorder, and type 1 means an absolute deficiency in insulin production. Now, this is caused by our body attacking the beta cells in our pancreas. So, insulin is required to allow glucose to meet our needs. Think of our cell as a house. Think of insulin as a key, and it's going to open the door to the cells in our body to let glucose come in. So when we don't have insulin, we're truly not feeding our cells. What are the clinical features of a patient with diabetes mellitus type 1? So there's an onset of characteristics, and usually you'll see this in children or young adults. Typically, these patients are very thin. Remember, we are not feeding their cells. Glucose cannot get in due to a lack of insulin. These patients will have hyperglycemia symptoms, and they usually start suddenly. So we're going to see weight loss and those 3 Ps. So polyuria, lots of urination, polydipsia, thirst and drinking a lot, and also polyphagia. These guys are hungry. They're eating a lot, but they're not getting fed. Ketoacidosis is an acid-base imbalance. And what you'll see is your patient breathing very fast, very deep. And they'll have a fruity breath blowing off those ketones. They could have blurred vision. They could have nocturnal enuresis, so they're up peeing all night long. And possibly they might have yeast infections because think of all that sugar in their body. That's a great food for yeast. Let's talk about chronic management of a patient with diabetes mellitus type 1. We have to give them a consistent meal and snack with portions and compositions, meaning balanced protein, fat, and carbohydrates. They'll have to frequently monitor their blood sugar, and they're going to do that with finger sticks, usually before meals and at night. They're going to have to keep a diary of those levels too for the healthcare provider so we know that treatment's working. These patients have lifelong insulin administration. Why? They'll never make insulin. Remember, this is chronic. Requirements are going to change with age. Younger patients do need more insulin versus an elderly person who has a slower, lower metabolic need. Now, make sure your patient is rotating injection sites. We want to avoid inflammation, infection, and at worst, cellulitis. They're also going to have to carry glucose tablets with them at all times and wear a medical alert bracelet just in case they have a diabetic emergency. Teach your patient to monitor for hypoglycemia and also all those signs of DKA. Patients with diabetes type 1 are also going to need extra food prior to exercise. Remember, when we're exercising, we're at a higher metabolic need and we're going to need more calories. Usually 10 to 15 grams of carbohydrates every 30 to 45 minutes of activity. Now, they're going to have to monitor those glucose levels a little closer when it comes to exercising, usually before, during, and after. They're going to have their hemoglobin A1C checked every 3 months with their healthcare provider. Don't get tripped up on NCLEX questions. A diabetes type 1 patient actually needs more insulin during illness, infection, or stress. Think about it. They have a higher metabolic need at that time. Teach them to keep a spare bottle of insulin and always store that insulin properly, which is going to be in a dry space, although it can be refrigerated after you open it. Teach your patient to test urine for ketones. Keep in mind, these are all hyperglycemia symptoms. Let's go to hypoglycemia. Hypoglycemia is going to be typically when their blood glucose is under 70. Now, the treatment for this is going to be those quick-acting glucose tablets that we talked about, possibly IM glucagon if unconscious, given by someone from EMS. Remember, this is a medical emergency. Think of diabetes like a plane. If your plane goes too high, you get sick from altitude sickness. But if your plane goes too low, you can crash and burn.